afternoon. Good afternoon, Rhode Island. It looked a little different backstage today because they have actually started live performances here, live streamed, and I was just told that it's the first orchestra in New England to have resumed live performances. So that should give us all some hope, and congratulations to the Philharmonic. So thank you, everyone, for tuning in to our Wednesday briefings. As a reminder, we'll be here every Wednesday at 1 o'clock. And if you haven't yet signed up for the daily email, I would encourage you to do that at governor.ri.gov. Although we are resuming our lives more normally, going out, going to school, going to work, there's still a lot of information coming out about testing, about therapeutics, about a vaccine, about the risks of coronavirus in Rhode Island. So I would encourage you to continue, please, to keep yourselves informed, to tune in at 1 o'clock on Wednesday, and to go ahead and sign up for these daily emails. So we begin, as we always do, with the data, and I'd ask if you could please put the dashboard up on the screen. You'll see it's a different looking dashboard. Last week we started with a new dashboard with a little bit more information to show you trends. I find it helpful. I hope you do too. Yesterday we performed over 9,000 tests. So it's a huge number of tests, and we saw 173 positive cases. So that is a percent positive of 1.9%. It's a little higher than we've been seeing, still excellent, below 2%, but you know, we'd love to be even lower than where we are, and so we want to make sure we stay vigilant. And sadly, we had one more death yesterday. A week ago, I announced that we just passed the milestone of 700,000 tests, and today, 1 week later, we've performed 770,000 tests. I will say a big thank you to everyone who's been involved with the testing team. We continue to lead the nation, and testing, it's actually now more important than ever. Now that the kids are back to school, more of us are out and about and working. Testing is key to keeping a lid on the virus and allowing us to live our lives. So I want to encourage you all to continue to get tested, and I want to thank everybody who's been involved in enabling so many tests. As you can see from the screen in front of you, and if you look at the trends in data, the percent positive, our weekly percent positive, has slightly decreased from last week, from 1.4 to 1.2%, and our cases per 100,000 has also decreased from 73 to 70. So that's good news. Good news, arrows pointing down is a good thing. It largely reflects the fact that we have acted very aggressively to get our arms around the outbreaks at Providence College and URI. Unfortunately, our weekly hospitalizations have ticked up, as you'll see on the screen, from 43 to 66. That isn't something that we want to see. Having said that, it isn't reason for panic. 2 weeks ago, when we saw 43 hospitalizations, it was an especially good week that week, and 66 is relatively consistent with the weeks prior. The weeks prior were 59, 58, and 66 respectively. So long story short, you see an increase from 43 to 66. That doesn't make you feel great. However, I don't want you to be alarmed. It's well below our hospital capacity, and 66 is roughly consistent with where we've been over the past month or so. Having said that, there have not yet been any hospitalizations, as far as we can tell, related to the outbreaks at PC or URI, and hospitalizations are a lagging indicator, so we're going to keep our eye on it. Bottom line is, feel confident, we're in good shape, we're keeping our eye on it, we're in constant contact with hospitals, ample supply of PPE, ventilators, and hospital beds, and just continue to follow the rules. As always, I want to provide a very quick update on the weekend report and what we saw in our business inspections over the past week. And of course, I want to thank the inspectors at the Department of Business Regulation for doing a fantastic job. It's not a fun job, but they're doing it, and they're doing a terrific job. So they inspected about 1,000 businesses last week, and overall, the headline, great compliance. Mask wearing, high-touch cleaning, compliance with capacity restrictions, all over 95%. Area where I still would like to see us do better is health screening of customers and staff. So this is the symptom screening of customers and staff. It's at 89%. That's something, there's no excuse for that not to be at 100%. In fact, the simplest thing is, if people have downloaded the Crush COVID app and they do their symptom tracker, simply ask them to show you the green smiley face. You know, that's enough. You don't have to you don't need to take temperatures, although if you want to, you can. But I'm asking you, please, for the 11% of businesses that still aren't doing the health screening of customers and staff, and for some of the manufacturers that need to do a better job of screening every single day, every employee, please try a little harder so we can go from 89 to 100%. Bars continue to do a good job, and I know this is a very difficult time for you. I would just say that crowding in the bar area, we saw a little bit of a dip in compliance, and the number of bars that had customers too close to bartenders doubled from 7% to 14%. This is the first time in almost 2 months that we've seen the number in double digits. So look, 14% isn't alarming, but it means we're getting a little too relaxed, maybe a little lazy following the rules. And I'm asking that we do better, that bar owners and those of us who attend, you have to try a little harder. You cannot crowd the bar. You cannot get too close to the bartender. That's how people get sick. Those are clear super spreader type events, and we're going in the wrong direction. So I'm asking you now, please, if you're going to go into a bar, if you own a bar, if you're going out for dinner and go to the bar area, please, please, if you find yourself in a crowded space, stop. You're doing something wrong. You know, back away, go get some space, go back to your table. Also, we are seeing a little too much crowding outside of the bars, people waiting for a table, or restaurants as well, bars and restaurants, folks waiting for a table, congregating outside. Please try to do a better job with that. Please keep your mask on even if you're outside. I would ask restaurant owners and bar owners in their 20s. So, and by the way, this isn't a Rhode Island thing. This is a struggle all around the country. Last week, I spoke about the outbreak at PC and to a lesser extent of the issue we've had at URI. And I've been asked, how has that impacted our overall number of cases? So I wanted to share a slide that helps illustrate what we've been seeing in the data. And I'd ask if you could please put the slide up on the screen. So if you look at this slide in front of you, it's pretty alarming and pretty crystal clear where we're struggling and what age group is not following the rules. The slide on your screen shows the 3-day average of cases among different age groups over the past 2 months. And as you can see, every single line is relatively flat. In fact, some of the lines are generally decreasing for every age group, except one, the red line. The red line indicates cases among people between 19 and 24 years old. Between 19 and 24 years old had a huge spike about 2 weeks ago. It's notable, it's obvious, it jumps off the page. We are working closely with our college leaders to get this under control. And the good news is you'll see also from what's in front of you that the cases are coming back down in that age group. It was a spike and it's coming back down. Having said that, it's still the age group, 19 to 24, where we're seeing the most spikes. We're seeing the most cases. And the reason, which we know from our case investigations, is that college students are still socializing with different groups of friends, not wearing masks, and we know that that causes the virus to spread. So I'm talking directly to the group of folks in that age group and asking you to do better. You may be young and healthy, but you're spreading this to people who aren't young and healthy. And so for the sake of your loved ones, for the sake of the rest of the Rhode Island community, for the sake of the many, many, many restaurant owners and hotel owners that I have heard from whose businesses are suffering because we went back on the travel restriction list for New York and Connecticut because of the outbreak at PC and in this age group, I'm asking you to do better. By the way, most college students and most college administrators I think probably are doing the right thing. And student leaders have stepped up on their campuses to help us out. And I want to thank you all for doing that. And frankly, we want to hear more from you. But to those of you who aren't doing everything you need to do, it's time to get a whole lot more serious. Today, I'm announcing that we're going to be convening a young adult task force led by students from across Rhode Island's colleges and universities. The task force is going to include also local leaders and representatives from high-density communities, and they're going to develop new recommendations for meeting students where they are and communicating our public health guidance in a way that's clear and effective and actually drives behavior change among these college students. The challenge we see among college students, and we know this because we do the case investigation talking to them, is they're just mingling with too many people. I'm asking you, the name of the game is keeping your groups small and steady. If you're living in a dormitory, hang out with the people in your room, not with the people in your entire dorm. If you're renting an apartment, hang out with your roommates in your apartment, not with the people, if you're renting an apartment in a house, not with everybody in the house. And if you are with everybody else in the house, you have to wear your mask and you have to keep a distance. We are finding that young people are socializing, the groups are just too large. They just are having too much social engagement with people in the neighboring house, in the neighboring apartment, and without wearing their masks. We're seeing pretty poor mask compliance in social settings by this group of 18 to 24-year-olds. So I'm just asking you to do better. This area is going to be an area of focus for the Young Adult Task Force, and we're going to be relying on them. Leaders on college campuses, leaders from that age group to help us. We need to figure this out. Maybe it's incentives. Maybe it's a different way of communicating. Maybe it's providing more mental health. I know it's frustrating to be in quarantine or to be in isolation. So we'll have more information about the task force in the coming week, but I'm excited to try it. We have to do something different. We're not reaching these young people. They are not following the rules. They're putting the rest of Rhode Island in danger. And so to the college leaders who are doing a good job, thank you. To the college students doing a good job, thank you. And to the leaders who are going to step up and help us, thank you. I think that we're going to get some good ideas out of this where we can bring our message more effectively to that age group and maybe provide some interesting incentives for them to actually wear their masks and keep their pods small. Okay, shifting gears, I want to talk for a minute about the Take It Outside campaign. This is going great, and thank God Mother Nature is cooperating. We had a beautiful weekend, and restaurants saw some pretty good business. I have to say I've been inspired, really, inspired and humbled to see how hardworking and creative our restaurant owners and retailers are. When we launched the Take It Outside initiative, people really stepped up. They really stepped up and have come up with unbelievably creative, can-do ideas to help themselves and keep themselves in business. We announced it 2 weeks ago, $1 million in funding to help all businesses move outside. And at that time, we asked for municipalities, industry associations, chambers of commerce, other organizations to send us proposals on how you would use the money. I I wasn't sure how many we would get or if it was a good idea, but in a crisis, you have to try things. I thought maybe we'd get a couple dozen proposals, which would have been great. Instead, in only 2 weeks, we've received over 80 proposals, and they are fantastic. These are good ideas, innovative ideas. Um, Ideas that include simple things like outdoor tables and lighting, or creating a lending library of heat lamps. I thought that was creative. Um, Lending or purchasing additional equipment for businesses, Wi-Fi hotspots outside of state libraries in order to allow for expanded outdoor programming. So because of the fact that the quality of these applications is excellent and the fact that we have so much demand, today I'm announcing that we'll be adding an additional $4 million to this program, bringing the total amount of funding to $5 million. Tomorrow, we'll be announcing the first round of those grants, the first $3 million, and then we're putting aside an additional $2 million for a second round. So if you have submitted a proposal, you'll find out tomorrow if you receive a grant. If you haven't yet done it, but you think it's interesting for you, go visit takeitoutsideRI.com, because we're going to do a second round. And again, it's for all kinds of businesses, libraries, nonprofits. The science is crystal clear. It is much safer to be outside. So if we can help you to take your business outside, or allow people to shop outside, or exercise outside, or study outside, then put in a proposal and we'd be happy to look at it. I have small bit of good news for restaurants. I will say to all those, especially restaurants who've been taking it outside, huge thank you. It's really hard, really, really hard. I know you're putting on a brave face. I talk to a lot of folks who own restaurants and waiters and waitresses and ask you how you're doing, and you're just getting by. I know that's how you're doing. You're trying to survive. So I want to thank you for your strength and your courage and your community spirit. And I hope Take It Outside helps you. I have a little more good news. Because it's clear that it's much safer outside, and because you're doing such a great job following the rules outside, effective immediately today, we're going to be easing the table spacing requirement outside from 8 feet to 6 feet. So starting now, outdoor tables for outdoor dining only have to be spaced 6 feet apart instead of 8 feet apart. Now, I realize this isn't a very big deal. It's only 2 feet, but it is I also know you're hanging on and every dollar matters. So it is my hope that you can fit a few more tables in outdoors and do a little bit more business for the next couple of months. So I hope those extra tables will help you just a bit. And I want to thank you again for your cooperation. And that's effective today. Just a couple more announcements. I want to take a minute to talk about testing and begin with our K through 12 testing system. So to give you a flavor for it, over the past 2.5 weeks, we've tested about 4,000 students, teachers, and staff at our public and private schools through our separate K through 12 testing system. Of those, we've identified 60 positive cases through the K through 12 system. Additionally, we have found another 100 cases among the school community just from the regular testing systems. And in that 160 cases, it's roughly equal between the kids who are learning from home and the ones who are in school. We set up here in Rhode Island, we're the only state in the country that I know of that has a dedicated separate K through 12 testing system. We did that because we wanted to make sure our teachers were safe and it was convenient for them to get tested, and the same for everyone in our school community, students, everyone, families, etc. And we wanted to be able to move fast. You ought to be able to get a test that day and also get folks into quarantine quickly. I will tell you, after doing this for 3 weeks, it's going very smoothly. It is not perfect. It's a brand new system. We're the only ones doing it, but it's going incredibly smoothly. 4,000 tests have been processed in a short period of time. Results are getting back to folks. We are pretty quickly identifying positive cases, getting them into isolation, doing contact tracing, and at this point, we're not seeing any evidence of widespread transmission of the virus in schools and in the school community. So it's going very well so far. Huge thank you to the National Guard. Would not have been possible without the Rhode Island National Guard and their leadership. And just a big thank you to everybody, to principals, superintendents, teachers, parents, students, everybody who's rolling with it and being patient as we learn together how to get the kids back to school safely with coronavirus. The biggest area of confusion so far that we have is from people saying, how do I get my test result? When do I get my test result? So I want to try to address this, and I'm happy to answer questions. If you're sick, if you have symptoms, so if you wake up and you feel sick, or you're in school and you start to feel sick, you call the testing number and we get you tested that day. You're going to get 2 tests, a rapid test and then a test that takes a couple of days to get you the results. In most cases, you're going to get the result of your rapid test that day. Not while you're there, but later that day. If you get your test after 3 o'clock in the afternoon, it might take till the next morning for you to get your result. But if you get there before 3 in the afternoon, we guarantee you'll get your result the same day. If it's late in the day, you might have to wait till the next day, first thing in the morning. If you're asymptomatic, so if you're getting tested because you were told you were close contact, or you don't, you're getting a test even though you're not sick, you are only going to get 1 test. And that test will take 2 days before you get your results. Why is that? Because the rapid tests aren't as effective on people that don't have symptoms. So if you go to the K through 12 testing site, but you're not sick, you'll get a test and you have to wait a couple of days for your results. Now here's the part that people are getting confused. If you test positive, you're going to get a phone call from the Department of Health. So you test positive, they will call you. And please answer the phone. It'll come up, your caller ID, it'll be clear it's coming from the Department of Health. So if you're positive, we'll call you from the Department of Health. But if you've been tested and it's negative, you're not going to get a phone call. You're going to be emailed your results. You'll get an email with your results. So if you went to get tested and it's been like 3 days and you haven't heard anything, check your junk folder or your spam filter. You probably got an email and it's lost someplace in your inbox or your spam filter. If it's still not there, then call back. We're saying this because we have a lot of people calling the very next day, and it's overloading the phone line, and it means the hold times can be, longer than we want them to be. In the next couple of weeks, we're going to be rolling out an online portal, which will make everything easier. And so when you get tested, you can just go to that portal and get your results, but we're not quite there yet. So the thing I'm trying to say today is, if you go and you're sick, you have symptoms, you'll get that result that day. And if you're positive, you're going to get a phone call. If you aren't sick, you have to wait a couple of days to get your results. If you're positive, you're going to get a phone call. But in any of these cases, if you're negative, you're just going to get an email telling you the result and telling you it was negative. And if after a couple of days you haven't heard anything, check your spam filter. If there's nothing there, please call us and we'll figure out what's going on. So I hope that's clear. And again, as I said, in a couple of weeks, we're going to be rolling out an online portal where everybody can just go there and check their results. Now, a couple other reminders. If you have symptoms, if you feel sick and you test negative, that's good news, but you still need to wait until you receive both of your negative test results and you're symptom-free for 24 hours before you go back to school. If you were tested because you were told you were close contact, then you still need to quarantine for 14 days, even if you test negative and feel fine. And to remind you, a close contact is if you've been someone who's positive within 6 feet of them for more than 15 minutes. To be clear, this is a big deal for schools. To be clear, you are not a close contact just because you're in the same classroom or in the same school with someone who has a positive case. The Department of Health will call you and tell you if you've been in close contact with someone who tested positive. You don't need to quarantine unless the Department of Health tells you to quarantine. By the way, I know quarantine's a drag, especially if you're not sick. But I'm asking you please to take it seriously. Quarantine means staying at home. You can go outside, get some fresh air. But if you're in quarantine, if the Department of Health has told you you were in close contact and you're in quarantine, you can't play sports, you can't hang out with your friends, you can't socialize, you can't go out or to the store, or, like I said, being with your friends, it means staying at home. This is rough. I hear you, this is rough. So to be clear, this means you're not sick, you feel fine, you've tested negative, and you're sitting at home for 14 days. Yes, I'm sorry, those are the rules as they are. You can do virtual school from home, and please don't play sports, don't socialize, because there's a possibility that you still may have the virus just because you tested negative on one day, 5 or 6 days later, you could find out that you test positive. So following the strict quarantine rules is really the only way to prevent outbreaks and keep schools open. By and large, you're doing a great job. Everyone's doing a great job, and we've had no real outbreaks or problems in schools or widespread spread. But I'm sorry, this is very inconvenient. I have some good news related to testing. I had a phone call 2 days ago with the other governors and the White House, and we were notified that this week, Rhode Island, along with every state in America, is going to start receiving a new, pretty amazing, game-changing, rapid type of COVID test. It's called the Binax Now test. The Binax Now is a completely different kind of a test from anything that we've been using. It doesn't require a machine to process, and it's very easy to administer. The swab is very comfortable, relatively comfortable, and you get your results in 15 minutes. Rhode Island, our allocation is over 300,000 of these tests between now and the end of the year. So we're going to be getting more information on exactly when we'll be receiving them and in how many installments. But this is huge. This is great news. So 300,000 tests of the Binax Now for Rhode Island from the federal government. And as I said, they're comfortable, they're rapid, and they're very effective. And I think the doctor may be talking about this. What we're doing right now is trying to figure out where we deploy these tests. So Dr. Alexander Scott is working with the testing task force to figure out what's the highest and best use of these 300,000 tests. K through 12, colleges, urban communities. It's a powerful tool, and so we're trying to figure out exactly the best way to use them. I will have more to say about that next week once we have finalized our strategy. Finally, the happy topic for the last, Halloween. It's a question that I've been getting frequently. So I have good news. The show will go on. This year there will be Halloween in Rhode Island. So get ready for your costumes. But like everything else, it's going to look different. So, and there'll be extra precautions that you have to take. But the good news is you can get a costume, you can go out and get your candy, and you can eat a lot of candy. I'm probably going to get in trouble from the doctor for saying that, but it's Halloween, so I hope you eat a lot of candy. Dr. Alexander Scott is going to speak in more detail about what Halloween will look like, but I'm just going to give you a quick high-level overview. Remember, outside is better than inside. Outdoors, better, safer. Trick-or-treating is okay. Go in a small group. Who you know. Wear your mask, not a Halloween mask. You can wear a Halloween mask, but that won't protect you or prevent you from spreading the disease. Wear a regular cloth mask or surgical mask. Keep your group small. Wash your hands constantly. Try not to stay out forever. And, you know, just be sensible about it. No big parties. No house parties. No house parties. We are going to be on high alert for big Halloween house parties. So we're trying to do the right thing here, allowing the kids to trick or treat. And she's going to provide the rules. But I want to say to everyone else, and particularly college students, I know this is a big time for partying, Halloween costume parties. Don't do it. Don't even try it. We will bust your party. We will fine everybody $500. Don't even think about it. So Halloween will go on for the kids. They can do their outdoor trick-or-treating safely. For the rest of us, for everyone, no social distance, limit is 15, no big parties, no gathering in bars, no big Halloween bashes. You know, be smart about this. We don't want to have a repeat of what we saw after 4th of July, or frankly, what we're seeing all over the country, where one bad weekend, one big party, one event can cause to a big outbreak 3 or 4 weeks down the road. And the last thing I will say is this. I would just ask you to be smart about it. There are certain communities which have a higher prevalence of the disease, are more densely populated urban communities. So if you live in one of those communities, just be careful. We now know how to keep ourselves safe. So follow the rules, use your common sense, but go ahead, get your costumes ready, and enjoy Halloween. Okay, I'm going to turn it over to Dr. Alexander Scott, and then we'll answer questions.
Thank you, Governor. Good afternoon, everyone. Thank you all for joining us today. To get started with the data, as the governor said, we have 173 new cases to report. There are 103 people currently hospitalized with COVID-19 in Rhode Island. Of these people, 8 are in an intensive care unit and 5 are on a ventilator. Sadly, we have 1 new fatality to report today. This individual was in their 70s. It's important to acknowledge our sympathies continue to be with the families of the dear Rhode Islanders that we have lost. That's what helps us stay focused on what we need to do in being vigilant. So I usually wrap up with an overview of what we're seeing in our case investigations, but I want to get into that now because it's directly relevant to what the governor was discussing about young adults in particular. Between September 15th and September 21st, we identified 685 new cases. 203 of those cases, which is 30%, were among people in the 19 to 24-year-old age bracket. People in this age group make up 9% of our population, but they represented 30% of our cases. That compares to 81 cases the previous week, which was 14% of that week's cases. Another trend we are seeing is people are not always being completely forthcoming with our case investigators when they get called by the Rhode Island Department of Health. I want to really speak to this. Please, we need you to answer the questions that are asked honestly and openly. We need you to answer when we call and to work with us. It's recognizing whether you are a young adult or a senior. The purpose and the goal with case investigation is to keep you safe and the people around you healthy and safe. We cannot do that unless you answer when we call and you provide us with the information that we need. We need your help in being able to do that effectively. Another way that people can help us is by making us aware of social gatherings that are occurring that seem too loud or too large, loud as well, seem too large, or where people are not masking. We have a number to call that we want to continue to make known to everyone if you want to report a social gathering that is larger than 15 people or involving people who are not masking effectively. That phone number is 401-764-5554. The phone line is anonymous, so please don't hesitate to call. That's how we can all work together to help ensure that we are keeping each other safe. We need to turn the numbers around that we are seeing. As the governor said, we have been doing a lot of testing, particularly within our K through 12 community for students, teachers, and staff. We also have more capacity than demand right now. We've done roughly 4,000 tests, as have been mentioned, while we have capacity to do 5,000 tests a day. So I want to continue to mention, particularly if you have symptoms, if you work in a school and are feeling any symptoms of COVID-19, call and make yourself an appointment to get tested. Remember, the earlier in the day, the better. If the student in your life has symptoms of COVID-19, as early as needed, call and make an appointment for him or for her to go ahead and get tested. Do not delay. We have a system that's set up, that's rapid, that's catered specifically to our K through 12 community, one of the most advanced systems with this in the country. Let's use it. Let's make sure that we use the capacity. The number to call is 844-857-1814. You can also go to our website, health.ri.gov/COVID, and click the testing tab on the left. As the governor said, we have roughly 163 K through 12 cases to date total. I was asked last week as well what we are seeing in terms of symptomatic versus asymptomatic people within the K through 12 community who are testing positive. Among people in the in-person learning community, we have seen more people displaying symptoms. 63 of the 84 were displaying symptoms. It's still early in the year, but it's also important to note that we are not seeing widespread outbreaks. That means we're not seeing secondary or tertiary transmission, otherwise described as a second or third wave of illness. That's an important marker. As people can see in the school data that we updated online today, we have had schools with more than one case, but it's important to recognize that those cases tended to have a common exposure, oftentimes even outside of school, whether siblings or sports teammates. One other update that I want to provide is on our alternate hospital sites, which people have sometimes called our 3 field hospitals. As people may have seen in the news earlier this week, we decided to decommission 2 of those 3 hospitals. We had established an alternate hospital site at the Rhode Island Convention Center in Providence, a second one in Cranston, and a third one at Quonset in North Kingston. We've chosen to decommission the hospitals in Providence and North Kingston while keeping the third facility stood up in Cranston. This was a decision that was made very carefully, just so that everyone really understands. We looked at a decade's worth of flu hospital utilization data in Rhode Island, as well as we looked at what we are seeing now and what we could be seeing when it comes to COVID-19. We determined that we have the capacity to safely care for patients at the volumes we could conceivably see without those 2 facilities going forward. Another piece of the puzzle that's critical is that the traditional hospitals throughout the state have had several months to refine their surge plans, and they have all learned from experiences with COVID-19 patients. They are all better positioned to ramp up now should the need arise. And none of the hospitals currently are overwhelmed in any way. Although these 2 alternate hospital sites were never used, I want to recognize and thank the teams at Care New England and Lifespan, who did a tremendous amount of work to get these sites ready to go and to provide high quality care. We asked for their help during a very uncertain moment, and they stepped up and did a phenomenal job. I also want to recognize the team overall, Rhode Island National Guard, the Governor's Office, the Rhode Island Department of Health staff, REMA, so many across the board. Particular, Alicia Mahalakas is an excellent example of one of the many superheroes I think of when you look at the entire statewide response. So I want to say thank you to her. Oftentimes you'll hear me say, it is truly a team effort. She and so many others are examples of the types of teams that have worked diligently together to help make people safe in Rhode Island. All right, the last topic I want to address today is Halloween. As the governor said, we want Halloween to go on, but it has to be done differently this year, just like so many other things that we're doing is being done differently. First and foremost, everyone knows this, we're going to continue to say it. This is particularly important. If you are feeling sick, you cannot participate in trick-or-treating this year. That means not going out from house to house with symptoms or not leaving candy out for trick-or-treaters. Both of those should not occur if you are feeling sick in any way. All parents should do a symptom check with their children before heading out, please. That means actively determining whether the child in your life has a cough, fever or chills, shortness of breath, muscle or body aches, diarrhea, headache, sore throat, nausea, or any of the other COVID-19 symptoms we have been discussing. It's critical to do that in advance. If you are going to be trick-or-treating, stay with your regular contacts, your small, stable groups. For people who expect trick-or-treaters, you should not open the door and offer a bowl for kids to reach in and mix and take candy out. A creative way to do this differently is to leave individually wrapped goodie bags outside. Alternatively, you can leave individual pieces of wrapped candy on a baking sheet that's spread out. So no one's touching something more than once. Someone is able to go and pick it up. Children can enjoy the experience, and we can do it safely. Put out a few at a time as you're putting out either the goodie bags or individually wrapped candy. And put more out if needed when trick-or-treaters are not on your stoop. People at home should be washing their hands regularly. People who are going from house to house should bring hand sanitizer along and use it each time in between, or as many times as you can. As we are saying, and will continue to say, masks are absolutely required during Halloween and trick-or-treating. To be clear, that means using one of the face coverings that we have been talking about and wearing for a few months now. It does not mean using a Halloween mask from your costume to feel like that replaces the cloth face covering. The Halloween mask is not enough. Some examples of what people can do is face painting and then designing a face cloth covering that aligns with your Halloween costume to make sure that that's being worn. Please make sure that we continue to mask. That is the critical tool to help make Halloween safe this year. And finally, as the governor said, and we cannot say enough, this is not the year for Halloween parties with people from outside of your household. We need people masking at all times with anyone that you are interacting with outside of your household. We've posted guidance online about Halloween as well as fall activities more generally. Apple picking, going to farmers markets, taking hay rides. You can find all of this guidance on reopeningri.com in the Parks and Recreation section. We want to be able to have Halloween this year to allow this all to go forward as we've described. But for that to happen, we all need you to follow the 3 W's between now and then and beyond. We need you to wear your mask, wash your hands, and watch your distance. 6 feet between you and others. With that, we'll get things opened up for questions.
Doctor, regarding the alternate hospital sites, the 2 that are decommissioned, what's going to become of their equipment, supplies, furniture, et cetera?
That's still being discussed. You want to add anything, Brett?
We're working through the Rhode Island Emergency Management Agency and FEMA, the Federal Emergency Management Agency, because there's certain requirements around storage of some of that equipment. So we'll be storing and cataloging all the equipment. That which needs to be stored will be stored. That which can be either resold or donated to other community partners will be donated. But the federal guidance around the specifics on that is still being developed nationwide.
Governor, there's 2 weeks left until the October 13th time to get students more back into school. You said the first 2 weeks have gone well. Do you have any indication that many of these school districts are going to ramp up their plans as you want them to do, and that's actually going to happen, or are many of them just going to stick with what they're doing now?
I think it'll be a mix. I think some are still waiting to see how we're doing. But for the most part, I think most are ready to go back to school full in person. So, we're even hearing some potential good news from places like Warwick, who are thinking about getting some of the kids back in school. So I think, definitely Providence and Central Falls, I think, are still going to stick with the hybrid. But I think most of the rest are going to go ahead and do the in-person school.
Do you expect to put more pressure on some of those that do not, seeing as though you kind of set that as more of a hard and fast time to start?
I am continuing to put pressure on them. But also, even more than pressure, we're doing a lot of behind the scenes work just to help them do the work to get the kids back in school. So we've sent some folks to Warwick, for example, to just sit down with them and say, you know, how can we help? What's it going to take? What are you most worried about? That's really what it comes down to. The education command center, what we call the Education Operations Center, they've done dozens of missions to the schools. Those are going great. So last week we had a Zoom call with all the superintendents around fans and HEPA filters. So some of it is pressure, because I believe more than ever that it's the right thing to do. I think the damage we're doing to kids by leaving them at home is clear and potentially irreparable, and I worry every day about it. But so I am going to keep the pressure on them, but also I want to enable them. I want to help them. What do you need? Let us help you figure it out. Here's the other thing I'll say. This is really rough on parents as well. You know, I was chatting with someone whose child has an IEP. She's left her job to stay home to try to homeschool this child. So that is financially really, really hard on her family. But she's not a teacher. I mean, she is struggling to do right by her child. So with each passing day, the facts are our contact tracing and testing is going well. We haven't seen any, widespread transmission. And we're hearing more and more stories from parents and kids who are really struggling and suffering for not being in school. So anyway, as you can tell, I feel very strongly about this, and I'm going to keep it going.
Governor, how did you arrive at the $4 million of additional funding for the outdoors program?
We went through the applications. It was an attempt to try to satisfy all the high quality applications.
Is it strictly for use by businesses that are trying to move their businesses outdoor? There's no additional funding for other businesses of other kinds?
It's for any entity who needs help taking the business outside, which we believe is pretty much any business. I mean, you can have office meetings outside if you have Wi-Fi. You can sell things outside. You can do yoga outside. You can do someone's nails outside. We've seen some the libraries going outside, restaurants outside. So it's pretty wide variety of businesses.
You said you were keeping $1 million or $2 million in reserve?
I think $2 million. Because we think that there's going to be more demand. We're going to do another application round and call for more applications.
Governor, good afternoon. Could you characterize, understanding that there won't be a budget decision until after the election, we're already there, but could you characterize the dialogue you've had or may not have had with Speaker Mattiello and President Ruggiero in recent times, and what's going on in terms of the Oversight Committee? How involved are they or any members of the General Assembly in any of the decisions that we're hearing about, whether it's schools or business, anything?
So I talk to each of them on at least a weekly basis. I think it's an understatement to say that we're deeply concerned about putting a budget together in November, absent any additional federal stimulus. So what we are doing now is putting together different scenarios. You know, if you have to balance a budget in November with no new federal money, what is that like? With some new federal money, with flexibility with the existing money that we have. Honestly, we're in a bit of a holding pattern until we have some more clarity from the federal government, but we're getting ready. I mean, we're putting together scenarios A, B, and C. They've committed to coming back in mid-November, and the hard work will really happen then.
But is it fair to say, from an oversight perspective, that the General Assembly has any even informal involvement in decisions that are being made right now?
I think it's not that different than how we typically operate. You know, the administration is administering the government, and I have talked to them. If anything, I talk to them more than typical in a time when they're out of session, because I'm having to make decisions, and I want to make sure that they're okay with what we're doing.
You mentioned that the Veterans Auditorium is going to have a performance, and the restaurants are going to move 8 feet to 6 feet. Are there changes in the schools that maybe they should be planning for? For instance, all theater in schools were canceled, and I know, in a lot of the classrooms, the kids have to be a certain distance. Is this something that maybe they should relook at, like all after school, like everything like that has been canceled for the schools?
I think right now that's appropriate. The performance here, there was no audience. It was a small performance behind stage, and it was streamed out. So, look, we got to get the kids in school. The next big hurdle is the week after Columbus Day, getting everybody in school. Then we'll give ourselves a little time, and then we'll reevaluate. So right now, I'd say no, but in a month or two, maybe.
Speaking of the speaker, he has you in one of his mailers. Did you sign off on that? And if not, you did sign off on that?
Yeah.
Okay.
Yeah.
So
He's
you
a
support him.
Democrat. I support Democrats.
It's also good to see Mr. Smiley once again. We haven't seen him in a while. But just final question. What is your reaction that there will be no Governor's Cup of PC and URI this year?
So sad. That is so sad, but it has to be. It is what it is, and it has to be. But I love that. So next year. Or maybe, who knows, maybe in the spring.
Who takes out the children? Does the first gentleman give out the candy, or does he take out the children?
I always get to take the kids out, usually.
Question, actually. So I have two questions. First, I know that you received a lot of notifications to your office about the tear gassing or chemical agents being used on protesters. I would like to hear you address that. And secondly, while the President of the United States is basically endorsing the Proud Boys and white nationalists, can you condemn them, especially the ones here in Providence? Can you make a very clear statement going against these white nationalists?
Yeah. So I appreciate you're here. This is, even though you're not a member of the press, I'm happy to answer the question. And if you want to talk, I'll be happy to talk to you later as well. Absolutely. It's beyond disturbing that the president would in any way condone white nationalists, and I condemn them in the strongest possible terms. There's no place for it, period. And to say it's deeply disturbing that he would do that is an understatement. With respect to the state police's role, they've been supporting Providence from the beginning. And I think I support them. Every use of pepper spray or any use of force is investigated, and these will be investigated. And that investigation will happen to see if they were founded. But by and large, state police and Providence police have worked well together to handle what's been going on in the city.
Governor, during a time though, during the pandemic and a virus that's going around that attacks the respiratory system, wouldn't you agree that police should be using tear gas and chemical agents absolutely last?
I think that their use of force procedures are appropriate. And as I said, they will be investigated, as they all are. And these will be as well.
I know you mentioned a lot, and you're putting a lot of the blame for COVID-19 cases on college students. However, on Atwells Avenue, there are a lot of people that are dying. The police block off the streets, and they don't wear masks, and they sit very closely. What do you say about those people and how they're adding to the spread of COVID as well?
The people on Atwells Avenue?
Yes, as well as the state police officers that do not wear their masks.
So I would say we've had excellent compliance by the troopers for masks. If they're not wearing masks, they need to. I know, in fact, I just called the mayor on Friday and asked if he could work with the folks in the Providence Police to increase their compliance with mask wearing. There's no excuse for anybody not to wear a mask, period. And if they're not, they have to try harder. The fact is, I'm going to put the slides up, we have an issue with people who are 19 to 24. That's not my opinion, that's a fact. The outbreak at PC is a fact. It's a problem. It's the single number one reason that we wound up on the travel restriction list for these other states. So, like, everybody has to wear their mask. So whether you're on Federal Hill or whether you're on Eaton Street, period. And if they're not, they need to. And nobody's above the law. The cops ought to be wearing their mask just as the governor, just as the president.
Well, Governor, if you started the Crush COVID program to make sure that we're trying to actually stop COVID, having state troopers not wearing their mask, and you're saying that they should be, but it's obviously a fact through the recordings from press.
We haven't found a big problem with that, but I can look into it further. They've actually had very good compliance, but if they haven't, they'll have to get better.
I'm sorry,
Tanya Signori from the Rhode Island Echo to the governor. I know this is a medical question, but if you could just answer it as the governor. There's a large number of people at home that are eager to hear your response. There's been a little uptick in the nursing homes, and basically they're wondering why we're still not isolation in nursing homes. Can that be mandated? We have isolation rooms in schools. A bunch of, all the schools have isolation rooms. Why can't hospitals and nursing homes be isolating more, even more than they're already doing? I know there's protocols in place and everything. However, with those protocols, there's still been some spread. So therefore, the disease probably is going further than 6 feet. Research has proven that. Also, if there could be, a mandate, I don't know if it could be an executive order in fact, or something where all hospitals and all nursing homes in Rhode Island all have a separate wing for COVID patients and separate staff, because there's been also some mixing of that. Can that be mandated?
Yeah. So I will give you my answer, but I do want the director to speak to it because she's much more in the details of this. For the most part, they are isolating and they should be isolating. And so, that's the answer. In fact, we even have some, like COVID specific homes. That is best practice. That is what they should be doing. We also have increased our testing in nursing homes. We've been doing it, and a week or so ago, we got more machines to do even more testing in nursing homes. So I don't know if you want to add to that.
Yes, the first part is to reiterate the approach in hospitals and nursing homes is to make sure that people who have symptoms are isolated appropriately and even more aggressively than what happens in other facilities. We have specific types of rooms that are available, particularly in the hospital, and we have wards and units when there's more than one case in a nursing home where that's allowed. The other element that I will add is oftentimes if we see cases connected to a nursing home in particular, it's less so because of the exposure there and more so because people who are from the community are working at the facility. So the importance of screening is just as critical as what you're asking about.
Thank you.
Tanya, do you have some places you're worried about? If you want to follow up with us separately, we'd be happy to do that.
Thank you.
We'll help you.
Scott, you could actually stay there if you'd like. Springfield, Massachusetts has banned trick-or-treating, and some of the logic they've described is they're concerned about people sort of clustering at homes as they're moving along and the lack of social distancing. Can you address why you think it's still safe to move forward with trick-or-treating here?
The critical piece is wearing a mask. Even in small groups, making sure that mask wearing is done effectively. It's not just the costume. That's what allows us to feel comfortable. We know that this is an important holiday. We know there are ways to do it safely. Wearing a mask is key, using the hand sanitizer, and following the additional steps that I shared. Making sure that we're not sharing candy, making sure that you're with your own small, stable group. Doors remain closed, so people are keeping their distance. Goodie bags or candies are individually wrapped. It's a way to put in place the measures that we know are effective while allowing children and families to enjoy Halloween.
Governor Raimondo, I'd like to talk about Twin River for a moment. With the acquisition of Newport Grand, Twin River effectively has a monopoly on gaming here in New England. As a result, a significant market advantage in terms of pursuing the consumer dollar. So they've got a monopoly. They've got the ability to have smoking on premise. They receive millions of dollars in marketing subsidies directly from, in many cases, the businesses that they're competing with for that said economic dollar. They were able to then give them permission to build a hotel despite the initial concerns about that. Now we've enabled a sports book and now a mobile sports book despite constitutional concerns. With regard to COVID, as of a week or so ago, now they're able to go 24 hours a day I understand that their Blackstone bar till 2 o'clock in the morning. At what point does the state of Rhode Island stop weaponizing their private-public partnerships in the terms of monopolies against the Rhode Island business community? We all know, every week we have a conversation how the entertainment and the hospitality industry in the state is crippled. And yet the state itself is essentially some of the biggest competition now for that limited consumer dollar. Where's the fairness?
So Twin River, as you know, was essentially closed for months, which is, of course, a big hit to the state's revenue and something we'll have to dig out of the hole of. But they don't have a monopoly in New England, as you mentioned. I mean, in fact, if anything, there's facing a lot of competition from nearby Massachusetts and Foxwoods in Connecticut. So I don't think that it is, as you say, a monopoly or weaponizing that facility.
No Rhode Island.
It is unique. We have a state-owned lottery. That's a unique system in Rhode Island. It's been a pretty good partnership for Rhode Island. We haven't had, I will say that they have been really great to work with during COVID. When we asked them to shut down, they shut down immediately. They stayed closed for months. They opened with just a toe in the water. We haven't had any issues with, compliance or spread of cases. And by the way, if we did, we'd have to shut them down again. So, they're operating their business, and it's the third largest revenue in the state. And so it's in all of our interest that they are successful.
Well,
and also their rules that the rules for them are the same as the rules for, the restaurants there have to abide by the same restaurants, not at Twin River.
I'm not questioning their corporate responsibility at all, nor the legality they operate within the rules of COVID. But at the same time, the state has granted them concessions, if you will, to operate that are impossible to get if you're a private business. And one only need to see the sort of destruction in restaurants and entertainment facilities in that area to see that they represent a huge drain on the Rhode Island economy.
Well, as I say, they're the third largest source of revenue for Rhode Island, and we share substantially in their revenue and their profits, unlike any other business. So it's an arrangement that the state made decades ago that, by and large, I think has accrued to Rhode Island's benefit.
Well, in closing, I think, without editorializing, what can we do then to expand or begin to re-expand the hours of ordinary businesses so they have a chance to compete against this monolith here in Rhode Island?
That's something that we will look at. We are going to continue to try to expand. It's a balance. I wish I could reopen every business tomorrow. Truthfully, that would be my desire. But we can't because then we would have too many. We'd go right back up the curve again. So I assure you that I am looking every week at the numbers, trying to push forward to a further reopening every time we can. Today was a baby step with the 8 feet to 6 feet, and we're going to continue to go down that path.
Doctor, question about the K through 12 testing system. If a person presents with symptoms, both tests conducted on them, the samples drawn at the same time?
Yes.
And then how do they show up in the dashboard numbers if both tests are negative, both tests are positive, and if the rapid is negative but the PCR is positive?
If both tests are negative, it shows up as negative. If both tests, once, just one time, per individual. Thank you. If both tests are positive, it shows up as positive one time. If either test is positive, it shows up as positive one time for that individual.
Governor? Yes. Did you watch the debate last night?
I did, yeah.
Thoughts?
It was, my primary thought is I really hope Joe Biden gets elected. To me, he was the only one on the stage that was presidential. As we talked about before, I'm embarrassed to have a president who tacitly approves of racism and white supremacy. And as it relates to COVID, it was on full display that President Trump didn't have a plan. And as a result, we're all struggling, and President Biden would have a plan. So that's what I think.
Doctor, I've heard from members of the Equity Council, the Bus Drivers Union, and members of the public this week on the questions surrounding GRIPTA buses and capacity and really the lack of a mandate for masking in ultimate bus shelters. What's your response to that? Because obviously on a 40-foot bus, you're going to have people, you're gonna have more, I think it's 20 people per bus that exceeds the 15. People are gonna, by nature, be closer than 6 feet together. So how does that get squared, and how can you ease the concerns that have been put forth by those entities?
Well, it's helpful to hear this. We can work with them further to address. We want everyone masking, whether it's mandated, whether it's in an EO. We want everyone to understand masking is critical in stopping transmission of COVID-19. That's the number one intervention that will keep us all safe going forward. So we'll continue to work on that. Thank you for bringing it up.